So this has been a huge story over the last couple of weeks, and this has been, there's been blame games, Jake.
It's been really interesting because the federal government maintains. They are responsible for aged care facilities. Period.
Yeah,
That's what it is.
Okay, well, I've been trying to look into this, and it's got such a sordid, weird history, our history of aged care in Australia. There's a really great documentary podcast thing on Rearview. ABC do a podcast called Rearview, and they did an aged care one this week, and they sort of did a lead-up of how we got to this point. Now, I couldn't follow the whole thing. It's one of those podcasts where I need to go back and listen to it again. But it really spoke about how... we started with the nursing homes and nursing homes, started off with nurses in them. Gradually over time that changed. They were no longer obliged to have nurses in them. Then it just became sort of staff members and that sort of thing who were there. So they stopped receiving these sorts of really high quality, I shouldn't say that. I should say that they stopped receiving people who needed nurses couldn't get access to nurses as easy as what they could, is what I should say.
Well, I suppose if you were in a high dependency area of a nursing home or aged care home, you would still have access to medical care. It would just it could potentially not necessarily be as much as what would exist in, say, a hospital. Caring for that same number and type of severity in terms of their patient load. So, okay. I mean, and as you say, like this has been long-standing, and for one of those, this is among the many reasons, I suppose, that we have an aged care royal commission going on at the moment.
Yes.
Because essentially it has been bad for a very long time. With that said, we still have a lot of people in aged care homes, and it is important to recognise that nobody is saying that we should shut down aged care homes right now and have everybody in hospital, although that is something that particularly in other countries, off the top of my head, it might have been Sweden that Sweden's got the let her rip strategy. It was one of the European countries, unfortunately I can't recall which, but when coronavirus first hit that country, they got all of the people in aged care homes into hospitals, and they were able to minimise the death toll significantly.
Right.
We've had 328 deaths thus far in aged care homes. That was as of Monday this week.
Okay.
So it's quite a significant number. But in saying that, it's not necessarily a large percentage of the patients living in aged care. But either way, in terms of responsibility, the federal government has responsibility for aged care. That's a pretty solid premise.
Yeah.
The other side of this is, and the way that the federal government have been pushing back is by saying that the state government has responsibility of public health emergencies. So while the federal government has responsibility over the aged care homes, the Victorian government should be taking responsibility for the, essentially all things during this public health emergency within Victoria. Okay. Now, if that confuses you, Greg, that's good, because it confuses everyone. And as a consequence, the federal government have been, firing shots at Dan Andrews, and Dan Andrews has been pushing back relentlessly, saying this is ridiculous. How did you not have a plan for this for this thing? We heard several reports this week saying that if you become ill, if you contract coronavirus, you have to immediately contact this federal government, this federal health department registry, and then nothing happens of that notification. So you can continue to go to work. you might be a
Mm.
temporary employee, and you might you might stop your employment at a particular place. You've already registered that you have the COVID virus, but you might go on and work another 2 days, 3 days later at a different aged care home,
Yeah.
and there doesn't seem to be a tremendous amount of information flow from that registry to each of the aged care homes. So it's a really wonky system. Clearly, it seems to be broken. And when questioned during a Senate inquiry this week, the aged care minister, Richard Colbeck, he had great issues with being unable to recall how many people had died in aged
Yes.
care, how many
Yep.
people had contracted COVID in aged care. He had great difficulty reciting how or what the systems that they've got set up in order to support particularly aged care homes in Victoria and New South Wales where there are active clusters.
Yeah.
It's been really, really wonky. And then during the middle of the Senate inquiry, he just got up and walked out.
Yeah.
Now sorry, go on.
Yeah, he's under a lot of fire this week. I know that there
He
was
is, yeah.
media following him around saying that, Scott Morrison has basically kept you out of all the decision-making processes now. I mean, look, it was such an own goal, wasn't it? I mean, it was such an easy. I mean, he was basically handed, how to do a good job on a platter, and he really messed it up. And for the fact that Scott Morrison is actually trying to, get himself out of this little pickle for apologising and all that sort of stuff, to have his aged care minister, coming up with so many blunders along the way, I don't know. It's not looking. I'm not this huge fan of if a politician makes a mistake, they should be fired, but I mean, if you're the aged care minister and you don't have these basic facts and you don't have this sort of basic empathy, I don't know. It's not. What do you think? I don't feel like it's looking great for him.
It's not. I mean, there are certain things that are expected of you, particularly in a Senate hearing, particularly in any sort of parliamentary sitting. There are things that are expected. Even questions on notice. You can say, look, I'm sorry, I don't have that in front of me. Let me get back to you in the next couple of minutes. I'll source that detail. I'll provide it to you. But this is one in this Senate inquiry. There was an expectation that he would be asked these specific questions.
Well, so he would just know that he would be going home at night and going, right, what do I need to follow up on, right? Okay, like some basic facts, like what has he been doing?
Well, and that sort of thing, and I don't profess to have any great knowledge about the inner workings of a federal department, but broadly speaking, a minister is in charge of a department. Right? In this case, it's the aged care department.
Yeah.
And there are a whole range of bureaucrats within that department, all of which are providing information up, and he's providing direction down, or he is providing direction and advice, etc., down. And the fact that he would have had a media advisor, he would have had a political advisor, he would have had a whole bunch of these people around him that would have said, these are the types of questions that you're going to be asked, and these are the things that you need to have at hand. The fact that he didn't have that sort of stuff at hand, that really shows something. I'm not sure what that something is. It shows, either a disconnection from the facts, a disconnection from the seriousness, or that he's not listening, that I don't know, but it seems wonky. It seems really, really bad.
It does. And, again, this is the point of our podcast, right? We don't profess to be political analysts or anything like that. So two average people, having a discussion about this, and it just doesn't feel right. It does. And when you break it down, you go, okay, he's actually an employee of the people. He's not employed. Right. And like you said, he's got all these staffers around him too. So he's getting paid through tax dollars. They're getting paid through tax dollars. You would that we have this certain level, we have a certain expectation that you're going to have all this information there, that you're actually actively working to make this a better system. And if you don't have these numbers here and you don't have this empathy here, what on earth are you doing with your time? Scott Morrison did actually apologise for some failings of the system, specifically around workforce shortages. He said that I'm sorry that if people there had to be removal of staff very quickly, and you're scrambling to find those particular staff, replacements. He said that that's not good enough. So he has apologised for some aspects of the aged care system falling short in some regards. He says on some days. On the days that the system falls short, on the days that expectations are not met, I'm deeply sorry about that. Of course I am.
Yeah.
So, yeah, but he does sort of specify a few things here and there about that. I know that Anthony Albanese has certainly come across as quite a bit more authoritative on this. They've certainly pounced on this like a kitten on a what?
Ball of yarn?
On a ball of yarn. Great. Sounds good. And I was going to say on a kitten, not a chicken. So yours was much better. And they've pounced on it, and he's come up with an 8-point plan, or some 8.8 suggestions around that, and been quite saying, right, well, if Liberals are going to appear to be quite unauthoritative on this particular situation, let's jump on it and let's make it look like we are authoritative on this particular situation.
And in terms of strategy and tactics, it seems highly appropriate that when the government is lacking in strength in a particular area, that the opposition could and should probably exploit that area, particularly if they can be, direct in, pointing out the specific failures, the specific areas of failure related to how COVID has been able to, shoot through these aged care facilities. I've seen also defence from people like Alan Tudge this week. I think it was on Insiders. He was asked, questions about how COVID has been able to proliferate so badly through aged care facilities, and he essentially responded saying that, look, this is a Victorian problem. It's thankfully the interviewer immediately responded and said, well, what about Newmarch House in Sydney? What about other facilities in New South Wales? Like this is the point. This issue, it goes across state boundaries, and it's for that reason that aged care is the responsibility of the federal government. Again, there's no surprises here as to why we are having an aged care royal commission. It is clearly dysfunctional. The federal government has never been particularly amazing, and this is any federal government. It doesn't matter who it is. They've never been particularly amazing at administering programs, which is why they devolve responsibility for programs through funding to the states. Health, for example, they give a huge budget to the states. The states carry out those things so that they can localize it. What do the people want? We'll customize it to those people in that state, etc. Whereas aged care seems to be one size fits all, and at this moment, the one size doesn't fit us.
No, I agree with you, and it's one of those things too. I suppose I wanted to pose this question to you because whenever a question about the numbers of deaths in aged care comes up, say in Parliament this week, there was this regular habit of saying, well, I don't think we should be politicizing it. I don't think you as the opposition should be politicizing the deaths of these individuals. This is a really tragic event, blah, blah, blah. What does it mean, do you think, to politicize something? Like, shouldn't it be politicized? Isn't it already politicized? Like, isn't asking that question in question time fair when it is the responsibility of the government to look after these aged care facilities? But when does it become a fair question? What's the line between a fair question and politicizing it?
I would say any time that involves cross-agency, cross-border, or state boundary, it is entirely, and particularly during a public health issue, it is entirely appropriate to politicize it, because that's when you can point out systematic failures. Probably when it's inappropriate is when it's, one private provider, and that one private provider, had done everything that they possibly could, but, within that there was, say, one or two staff members that did the wrong thing, that didn't follow procedure, etc. That's when, you can probably point to, after an investigation, that specific one was not a systematic failure of the guidelines, of the procedures, of et cetera, et cetera. They were all following infection control. They were all following, all of the appropriate things around that.
Okay.
But when it is multiple aged care, sorry, Siri's talking to me. When it is multiple states, when it is multiple aged care facilities, when it is during a public health emergency, and when we had known issues with that industry prior to COVID emerging, and you're able to point to specific systematic issues, that's when it is entirely appropriate to politicize it. Because that is absolutely the case here. Like, there are failings on multiple levels here that have led to the deaths of individuals. Some of the stories coming out from families, particularly, where there is just a profound lack of communication, where on one, in 1 minute, a family member calls up and says, "Hey, how's my parent doing?" And the nurse says, "Oh, look, I'll call you back. We're just slammed." No answer. They end up calling back later and they're saying, "Oh, look, he's fine." And then the person gets a phone call from a local hospital saying, "Look, your parents here, you need to come in. Things are not looking good." Like that is so sad and harrowing.
Yeah.
And there's not one case of that. There's multiple.
Yeah.
So and that's when, to answer your question specifically, or directly, that's when it's entirely appropriate to politicize things, because it is inherently political.
That's
all
what
of
I'm
these
thinking.
failures relate to a political failure.
Because it's interesting, isn't it? Because you've got this meme at the moment where the politicians will say, "Well, I don't agree with the with the foundation of your question," or whatever it is. I don't. Yeah, that's it. I don't agree with the premise of your question. And it seems like this. Oh well, I can't believe that you're politicizing this particular situation at the moment, given all of the harrowing deaths that are happening. It seems like that's a bit of a. It seems disingenuous. I think it comes across as disingenuous to me, anyway. But it does make you think about what is where is the line, and where do you start to become not sensitive to the families who have lost the loved ones during these times as well.
No, you're entirely right. There's no simple answer to this whatsoever. I'm just grateful that the Royal Commission was able to alter their alter what they were looking at to include the COVID, the response to COVID, so that we can ensure that we're learning lessons from the introduction of a pandemic to our country, during these types of circumstances.
Yep, absolutely.